Okay, good afternoon. My name is Lenny Reznik, and I'm responsible for enterprise imaging at Agfa Healthcare. I think we're a little bit unique here on the panel, as that we've been selling PACS for about 20 years or more, and we've supported many different storage technologies over the years. And for the last 5 years, we've been promoting a VNA, so I think we have a pretty unusual and global view of the problems that we're here to talk about today. So when we were invited to speak here at SIIM 2013, we were asked to talk about archive neutral vendor or vendor neutral archive. And the one thing that I want to really want to make sure that everyone takes home here today is really you need to start with the end in mind. Okay, I don't think it's really a question of which one is better or which one is worse than the other one. It really is what are you really trying to accomplish. And I think with that strategy in mind is really where you need to begin. You may have very specific goals, and you may have a lot of different goals, and that's okay. But at the end of the day, many different goals done one at a time will cost you more time and money, and may not give you the ultimate endpoint that you're really looking for. And I would argue that the strategy that you want to take out is probably a lot more patient-centric than maybe you're thinking now. How many people here are just responsible for radiology images? And how many people here are responsible for imaging outside of radiology? Okay, not too bad. All right, thanks. So I think when you're thinking about the strategy, I would argue, just like SIIM has changed its name from a radiology focus towards the enterprise imaging informatics, I would really encourage really thinking about that strategy from a whole enterprise point of view, not just from a radiology point of view. So really it involves a diagnosis of the problem at hand, again, across the enterprise. What are some of the guiding principles? It's not just a department that's really responsible for this. It really is many different players that are involved. And then what's the plan that you can execute against that strategy? Now I spoke a second ago about different goals, and there are many different goals that you may have. And each of these are probably something that you either are facing right now or you've faced in the past. So you might have an issue with image distribution and image access, and you're looking at a zero download viewer. Or you might have a data migration issue, whether it's going from one PACS vendor to the next, one media to the next, or one version of a certain software to the next one. Or you might have the CD exchange problem. There's a lot of vendors here talking about CD exchange here at the SIIM. Or you might just be looking at improved archive technology. Maybe you're still based on tape or optical. There's still some customers out there who are based on that. You want to move towards a spinning disk. Maybe you're interested in moving to the cloud. Maybe you're looking for a disaster recovery plan, a business continuity plan. Again, I think you also want to look at these different goals as individual projects, but not necessarily a strategy. Even enterprise imaging by itself, which is somewhat open to interpretation, is probably a lot more of a specific goal, or maybe not an all-encompassing strategy. So what we've learned from our customers in doing projects here in the US and really all over the world is that ultimately what they want to do is have a very patient-centric approach to the problem. And what they really want to do is make sure that the clinicians have access to every one of the images inside of the EMR at the right time. It's not enough to have all the images in one location in a VNA or an archive neutral vendor. It really needs to be integrated back into the multimedia EMR. It needs to be integrated back into the health information exchange. Could be even a patient health record, a PHR that you're integrating to. And I would argue that's more of a comprehensive strategy that would include many of those goals that I mentioned earlier. And of course, all of those are going to depend on a zero download viewer. You hear a lot about that today. Ultimately, you know that you want a system that's going to be working on any operating system, any browser, because your hospital probably still has Internet Explorer 2.0. And ultimately, you want to make sure that there's no framework involved. It's not just that there's no software involved and no app involved. You really want to make sure there's no .NET and no Java as well. Okay. So what we've learned again from our customers is much more of a platform approach that's also very modular. So you can go after specific goals one at a time. And again, there's nothing wrong with that. You may have a very specific goal in mind that you need to address because of a short-term problem. So you may just want to start off with a VNA first, or you may start off with a viewer first, or a CD exchange. But ultimately, at the end of the day, you're going to be looking at different solutions from different companies, and you may not really get what you're looking for, which is an integrated solution. What we have done, working with our customers around the world, is really take a platform approach. And when you think about it, this is very similar to what the EMR companies have done. EMR companies have 30, 40, 50 applications that are all integrated together, and you know that they're working. So there's nothing wrong with a best-of-breed approach. certainly that is very effective. But at the end of the day, when you're really thinking about long-term strategy, I would encourage you to take a look at a platform approach so that you know from a vendor that you can get all these things to work together. And I think that's much more in sync with EMR vendors today, and I think that's very consistent with what you'll hear from your CTO, from your CMIO, and from the CIO. So I think what's also important to ask a bunch of questions when you're going down this path or a VNA or an AMV, and that is, who owns the IP? Is it the company that you're buying it from? Are they a reseller? Who's going to wind up doing the service? And is the service going to be any better than what you're getting today? Because obviously you want to move forward and improve it. What kind of uptime guarantees are you going to get? How are you going to manage change control between your PACS and your VNA? Are you getting storage that's more secure? How many people here have storage on site or in the cloud that all of the data is encrypted? Not too many, and that's a pretty common issue today. But as you move to the cloud, all the cloud providers out there are all encrypting the data, and I would argue that cloud technology is safer than might be what's on site today at your facility. So it's another good question to ask. ILM, Dr. Horry mentioned about that and the need for that. If they have a zero-click download viewer, do they have the ability to load the application on the VM in a server farm? Do they have mobile support? Is it a proven solution, or are you going to be the one really doing it for the first time? Well, not everyone has the stomach for that, and I think you need to make sure you understand how proven it is. What kind of resources will be doing this project as you move more towards enterprise imaging versus just radiology? And then I think ultimately it's the user experience. What is it going to mean for the system administrator? Do they have to worry about syncing PACS to the VNA or the archive neutral vendor? And what's it going to mean for the clinicians for the user interface, and also for the people in the radiology department from that access times? What are the issues that you're going to have to face? Those are some of the questions that I think you'll need to ask. So I think the question is where to start. And when I talk to customers, it really is starting in the radiology department. Radiology people really understand imaging informatics more than any other department. You're not going to find this expertise in dermatology or ophthalmology or point-of-care ultrasound. And it's really all centered around workflow. We sort of take it for granted because we've been living in the risk patch world for many, many years now, but other departments aren't quite there yet with matching demographics and patient images. It's that metadata that's really required to capture in these other departments that I would argue is the most important point that you need to do, because you want to make sure, again, the images come up in the EMR at the right time, at the right space. And just moving quickly, ultimately, it's not a project for one department. It really is an enterprise project. You need to get the CMO, CIO involved. How many people here in the room can walk into the CIO's office today and they know who you are? Okay, fair number, but I would encourage that for everyone, the CIO and the CMO. So really, you need to set the strategy, set the short-term goals, long-term goals. We live in a very dynamic healthcare market, so you need to take all those different things into account. Once you set the strategy, overall reaching strategy, what are the individual goals? You want to prioritize those, and then I think you want to ask questions of vendors and ask questions of all the users that it'll be that are involved. Last but not least, we're all informatics leaders. People in this room are really the leaders who will make enterprise imaging, archive vendor neutral, or vendor neutral archive happen. Thank you.